We've never shied away from tough challenges. In Massachusetts, we face them head-on, not just for our community, but for the entire world. From the first use of anesthetic in surgery, the first successful organ transplant, and in 2020, one of the first effective COVID vaccines. That spirit of innovating for the betterment of humanity continues as the Commonwealth battles COVID. From expanding testing capabilities to administering vaccines at mass sites across the state, CIC Health and its partners have been at the vanguard.
There was this big challenge in front of us, and that we were going to be the ones that got to bring this to life and to vaccinate thousands and thousands and thousands of people. You know, the work that we're doing, it's what it's all about. It's what life is all about. Like, life hits bumps, and coronavirus has been a very humbling bump, and a lot of people have lost their lives, their loved ones. To be in an environment where you're in the middle of a pandemic and you've got to respond quickly and you've got to build something from nothing, and you have to do it in weeks or days, not months or years.
We know about setting up operations and hiring people and software and all that. And to marry that with a really searing vision that Dr. Gwande had for how we could really fix this challenge that the country was facing, that gave us a purpose and a focus for those logistical skills, and it just worked.
Together, with the state of Massachusetts, CIC Health pondered how to apply their experience from the testing to the vaccination effort.
Today we're excited to announce that we finalized plans for the first mass vaccination site, which will be located at Gillette Stadium.
We know that part of how we set up this operation, how we create an experience, how we bring people through, gets us closer and closer and closer to bring people back to every one of those seats. Some students running at the Reggie Lewis track, to going back to Fenway Park and support our team, and going back to Gillette Stadium and have a Patriots game or a Revolution game, or have a concert in these places.
I can write to my hospital president to see if they would potentially be a sponsoring partner on the medical oversight. I can write to the Crafts and the Henrys about Fenway Park and Gillette Stadium, and if they're interested and say yes, it will happen instantly. And that's exactly what happened. It's go.
Great, let's do it.
It's a go.
The Cambridge-Boston area, we're so fortunate with the resources, the smart people, the organizations that are here. They really all just came together.
The day that we opened, I don't even know if I could put the emotion into words. And it was just an overwhelming sense of awe that somehow all of these great people came together to make it happen.
In a matter of weeks, tens of thousands of people were getting vaccinated every single day.
It's really about getting back to zero, right? Getting back to 0 school days lost, getting back to 0 jobs lost, getting back to 0 hospitalizations, 0 severe illnesses, and 0 deaths from COVID.
I told my mom that we were going to be saving lives, and that I was doing this in the spirit of people like her. When we have the opportunity to vaccinate people like my mom, she doesn't have to be scared to come see me or my brother or his children and the rest of the family anymore. And maybe she can go back to work and get back to her everyday life and not be so isolated anymore.
And as part of the Commonwealth's Vaccine Equity Initiative, CIC Health, along with the City of Boston and many, many other community-based organizations, have been working collectively.
This is the start of the next part of your life. To see people taking selfies of themselves while they're getting vaccinated, or asking a staff person to take their picture while they're being vaccinated. They want to tell the world, we're getting back to everyday life.
We, the CIC Health team, together with the Commonwealth, Mass General Brigham, and our other partners, faced this challenge head-on, finding creativity in the midst of chaos and innovative approaches to turn fear into hope. For our families, for our communities, for our world.
It takes people stepping up and saying, I will get vaccinated.
We really want to get as fast as we can to a place where our community can go back to filling those seats, and we'll get there. We'll get there soon.